Female patient, 37 years old, removal of dysplastic nevus cell nevi by means of Y-plasty left mammary. The treating physician uses temporary retraining threads in certain cases as here, performing an Y-plasty. These are removed approximately 1 minute after the fixation with epiglue, and the wound is then extensively covered with the adhesive. The healing process took place without infection and is well advanced on the 9th day. Within a short period of time, the scar will hardly be visible. Female patient, 45 years old. Removal of a dysplastic nevus cell nevi on the outer thigh. Even though the wound was under considerable stress, it healed without complications within 15 days. Female patient, 61 years old, removal of a nevus cell nevi, paravertebral left. Even though the wound of the 60-year-old patient was under strong tension, an excellent healing process took place. Removal of a very deep-seated cystic basilioma pre-auricular right. A subcutaneous suture was laid and the wound was closed with epiglue only. After 10 days, the wound has healed excellently, even though the patient is already 63 years old, which is typical for wounds treated with epiglue. Traditional wound treatment of lacerations on the lip cannot always achieve a cosmetically acceptable result. The wound can be treated without anesthesia. The adhesive does not cause a burning sensation and polymerizes within seconds. The adapted wound edges have been closed with a small drop of epiglue in the middle of the wound. Afterwards, the entire wound was covered with epiglue. The child was during the whole procedure free of fear and was even tempered. Already after a healing period of only 11 days, the wound is hardly visible. The patient is free of pain already at the first day after the treatment. The colorless adhesive is clearly visible, especially on the left wound margin. At the 4th day after the treatment, the healing success is clearly visible. The patient is free of discomfort from the beginning of the treatment on. Removal of a nevus with wedge excision and sutures. After 14 days, the result is not satisfying. Removal of a nevus on the collateral side of the same patient with radiosurgery and wound treatment with epiglue. Excellent wound healing after 14 days. Removal of a pigmentary disorder at the cheek via radiosurgery. The skin surface will be denaturated by touching it gently with a disc electrode. The crystal clear adhesive closes the wound infection secure. Due to the good status 3 weeks post-operative, the searched area will be hard to find after a short period of time. Closure of thorax after bypass surgery in the Al-Basel Heart Center, Damascus, Syria. The wound edges are fixated via forceps and epiglue is applied. The adhesive polymerizes in approximately 10 seconds, therefore the wound closure can be performed very quickly. it can be seen clearly that a second layer is applied for stabilization. This is the completely closed wound, which was healing without any infection.